Hello, this is Kim Jong-il. We are going to cover the third part on retrusive control and how it is applied to the premolar extraction cases. In the high-angle Class 2 premolar extraction cases, many first extract the premolar. How about Class 2 high-angle cases? They are the cases that the mandible is placed posteriorly. In this case, if we first extract the premolar and move, not only teeth movement but also condylar and mandibular movement is made simultaneously. The mandible would be placed downward and posteriorly. Condyle also would be placed posteriorly. At this time, if there is a contact somewhere on the premolar, the condylar is prevented from posterior movement. The premolar is very important in orthodontic treatment. The important role of the first premolar is forward, lateral, and retrusive mandibular movement. In the case of retrusive guidance and retrusive control, viewed from the lingual side, the upper premolar lingual cusp should be placed in the lower premolar distal fossa. However, it's not a common case in orthodontic patients. We should first check where the premolar is positioned from the buccal side. In other words, the cusp tip of the lower first premolar should be placed on the mesial marginal ridge of the upper first premolar. Then, it is the best for the palatal cusp tip of the upper first premolar to be placed in the distal fossa of the lower first premolar. In the Class 2 premolar extraction case, many use mini screws. They move the upper anterior dentition backwards and the lower anterior dentition move backwards by using mini screws. What would happen to the retrusive control then? It is likely to collapse. In this case, the upper incisors move backwards. It is good. Where should the lower premolar be placed? It should be placed anteriorly. We can decide the treatment strategy based on whether the craniofacial complex is an unchangeable or changeable structure. If the craniofacial complex is an unchangeable structure, the anterior teeth could be moved backwards as much as possible. It is because the craniofacial complex is an unchangeable structure. So many move the upper anterior dentition backwards by using mini screws and the lower anterior dentition as well based on this concept. However, if the craniofacial complex is a changeable structure, what is the best option for tooth movement? Like this, the compressed condyle may have anterior disc displacement. It means that the mandible should be moved forward. To do so, the upper anterior teeth should be moved backwards, and the lower anterior teeth should be moved somewhat backwards. And the rest of the posterior teeth should be moved forward. We need to make sure that after the eruption of the first premolar, where the mandible is adapted to. Where should the mandible head to? A or B? The mandible should be headed to B. In other words, the upper first premolar should go behind A and the mandible should go to B. To do so, it is important to lead the upper first premolar to be placed in the lower premolar distal fossa by putting the flowable resin on the lower first premolar mesial fossa. Let's check the diagnosis. There are small upper second premolars. If the upper second premolar is smaller than the upper first premolar, where is the lower first premolar placed? It is highly likely not to contact the upper small second premolar. If the upper teeth don't contact the lower second premolar, there would be a problem with retrusive control. If there is a retrusive control problem, where would the mandible be placed? The mandible and condyle is placed posteriorly. The posterior placement of the mandible and condyle means that it is likely to be class 2 malocclusion. In this case, which one is better? The first premolar extraction or the second premolar extraction? The second premolar extraction is better for not only aesthetics but also function. We should check whether the second premolar is larger or smaller than the first premolar. If the second premolar is smaller, the second premolar extraction is more preferable than the first premolar extraction. If the second premolar is extracted, retrusive control would become better. On the other hand, if the first premolar is extracted, key correction would become easier. In other words, it would be easier to make a class 1 canine relationship. Even though the second premolar is extracted, please keep key correction in mind. Then, orthodontic treatment would be easier while closing the space. Let's look at retrusive control. In the premolar extraction case, during treatment we first diagnose, then treat, and finally remove the appliances. I am going to give a lecture focusing on leveling and space closure. Let's review the diagnosis. Which one is better? Class 1 canine relationship or Class 1 molar relationship? Class 1 canine relationship is better. In this case, it has Class 1 molar relationship, but premolar occlusal contact is not good. We should check overjet, canine relationship, premolar relationship, and molar relationship. Forming Class 1 canine relationship and premolar occlusion. Retrusive control make treatment easier. I call it the magic triangle. Class 1 canine relationship means that the upper canine is placed between the lower canine and the lower first premolar. Retrusive control means that the buccal cusp tip of the lower first premolar is placed on the mesial marginal ridge fossa of the upper premolar. You should always check those during treatment. The upper canine is placed posteriorly like this. This patient has half class 2. Is it good or bad? On the other hand, in some cases, the lower canine is first moved backwards. Is it good or bad? Also, the upper second premolar can be moved mesially. In some cases, the lower second premolar can be moved mesially. In the case A and D with blue, it is a good case. If the upper canine is moved backwards and the lower first premolar is moved forward, the space closure is made and the canine relationship with retrusive controls is prevented from collapsing. However, what would happen if the lower canine is moved backwards earlier than the upper canine? The canine relationship would collapse. What would happen if the upper second premolar is moved forward earlier than the lower second premolar? Retrusive control premolar relationship would collapse. It is not good. Let's check the retrusive control in the premolar extraction case. The premolar relationship should be kept in the first premolar extraction of upper and lower cases. In this case, it is preferable for the upper canine to be moved backwards and for the lower second premolar to be moved forward. On the other hand, it is not preferable for the upper second premolar to be moved forward and for the lower canine to be moved backwards. Picture C is the second premolar extraction of upper and lower case. What would happen if the lower first premolar is first moved backwards to dissolve crowding? The retrusive control would collapse. It isn't good. So, the upper first premolar should be first moved backwards. Then, the extraction space can be closed while moving teeth, preventing the premolar retrusive control relationship from collapsing. What about the upper first premolar and the lower second premolar extraction case? If the extraction space is closed, the lower first premolar gets closer to the upper second premolar. Whole teeth movement can be made properly. For the retrusive control, in the first premolar extraction of upper and lower cases, the appliances are attached to upper teeth number 1, 2, 3, 5, and 6. The appliances are attached to the lower teeth numbered 1, 2, 3, 5, and 7. An open coil spring is attached to the tooth number 6. However, if short class 2 elastics are used, the occlusal plane would change. So upper incisors would be extruded. To minimize this, in the lower first premolar extraction case, the lower second premolar should be placed anteriorly. To move the lower second premolar efficiently, open coil spring can be attached to the lower first molar area. In the second premolar extraction of upper and lower cases, the appliances are commonly attached to the upper teeth number 1, 2, 4, and 6. Appliances are attached to lower teeth number 1, 2, 4, and 6. An open coil spring is used on the canine areas. At this point, the upper first premolar should be first moved backwards. To do this, an open coil spring is used on the canine areas. Then, teeth can be moved properly, preventing the retrusive control from collapsing. In the upper first premolar, the lower second premolar extraction cases, how should we attach the appliance strategically? The appliances would be attached to upper teeth number 1, 2, 3, 5, and 6, and lower teeth number 1, 2, 4, and 6. That's why in the lower second premolar extraction case, the appliances are not attached to the upper canine in the beginning. So, the lower first premolar is uprighted and moved backwards by using an open coil spring on lower canine area. While doing that, the lower first premolar contacts the upper second premolar. Retrusive control is made. In the high-angle, Class 2 extraction case like A, it is preferable for the mandible to be first moved forward rather than to be moved backwards as much as it can be after extraction. If the mandible is first moved forward and then the premolar is extracted, posterior mandibular or condylar movement can be minimized. Where should the mandible be placed to solve Class 2 malocclusion? It is preferable for the mandible to be placed anteriorly. In the Class 2 high-angle case like this, use of the posterior bite block is recommended. In the posterior bite block case, how would the teeth be moved? Posterior bite block or twin block can be used in the full Class 2 and half Class 2. If posterior bite block is used, the lower molar is intruded and the lower incisors are extruded. The occlusal plane would be rotated counterclockwise. The mandible is placed anteriorly. In Class 2 high-angle case, if there is a contact between palatal cusp of the upper second premolar and lower posterior bite block, it provides retrusive control. The mandible can be preventing moving posteriorly. Then, the upper anterior teeth are aligned and the extraction space can be closed. By using the posterior bite block in the mandible is placed forward and we can get positive results for Class 2 extraction treatment. In the premolar extraction case, there are some cases that the space in the premolar anterior area is observed. How should we use a power chain in this case? In this case, checking the canine key is essential. It is preferable for the upper canine to be moved backwards. At this point, is it good for the lower canine to be moved backwards or forward? It is preferable for the lower canine to be moved forward. So if the upper canine is first moved backward, then the lower canine is moved forward. The canine relationship would clearly become class 1. If the power chain is attached to the teeth from tooth number 4 to the other tooth number 4, because there is extraction space like A, the lower anterior teeth would be moved backwards. What about canines? It is also moved backwards. Then, there is a possibility for the canine relationship to collapse. It is important to minimize this. On the other hand, what about B? The power chain is attached to the teeth from number 3 to the other number 3. The lower canine would be moved forward. Then, the canine relationship would clearly become class 1. After that, if the space is closed, it is easier for the extraction space to be closed without collapsing the canine relationship. If there is extraction space, the canine relationship should be checked. Class 1 canine relationship is the best. Half Class 2 and half Class 3 is also okay. However, after space closure, you shouldn't make full Class 2 and full Class 3. If there is extraction space, full Class 2 and full Class 3 can be managed. However, after space closure, if the canine relationship is full Class 2 or full Class 3, additional appliances are needed to manage them. Let's look at this patient. There is anterior crowding. The mandible is slightly displaced to the right side. How should we close the extraction space when initially aligning by extracting the upper first premolar and lower second premolar and uprighting the lower first premolar? If the space is closed, lower canine is placed posteriorly. Half Class 2 can be full Class 2. The midline can be more displaced. In this case, the short Class 2 elastics can be used for about a month. What do we have to check at this point? We have to check the midline. Then check the canine key. Left canine key is Class 1, which means good. Right side is half Class 2. There is enough space in the mandible. While closing, it is likely for the relationship to be full Class 2. In this case, short Class 2 elastic can be used between the canine of the maxilla and the first premolar of the mandible for about a month. If the space is closed, the treatment would be easier. If the extraction space in the upper and the lower is closed, the midline is moved slightly to the right. Finishing would be easier by using Miolast. In other words, not only the canine relationship but also the premolar relationship should be considered during treatment. Let's look at this patient. The lower premolar cusp makes contact with upper lingual cusp. If the contact is made, the mandible cannot be placed posteriorly. What would happen if you grind? The Class 2 would become more severe. If the contact is made like this, leave it unchanged. And if the space is closed, the lower teeth would be moved backwards and the molars would be moved forward. Let's look at this case. Where should the lower premolar relationship be placed? Premolar relationship on the left is good. On the other hand, the lower right premolar should be placed anteriorly. I used to use an open coil spring and energy chain to create space when the space is not enough after space closure. What would happen? The retrusive control would collapse, break up. The midline is more displaced to the right. Everyone can close the extraction space, but they said finishing is difficult. If the relationship is full Class 2 on the right side, finishing becomes difficult. In this case, an open coil spring should have used for about a month for the lower first premolar to be moved mesially and used on the anterior canine. Then the midline would be centered. And then, if the extraction space is closed, the midline would be matched and the extraction space can be closed with retrusive control. While closing the extraction space, midline, canine relationship, and retrusive control should always be checked. Magic triangle means checking class 1 canine relationship and retrusive control of premolar. The premolar relationship is that the lower premolar buccal cusp tip should be located on the mesial marginal ridge of the upper premolar. In premolar extraction cases, leveling, space closure, and finishing are performed. At this point, if you understand the concept of retrusive control, the process of diagnosing, leveling, and closing and finishing the extraction space will be much easier. In the next part, we are going to cover the topic retrusive control in the finishing. Thank you for watching.